Hello, my name is Fred Trotter. I'm a healthcare data journalist with CareSet, and I am continuing this series on Datapalooza. We just had Datapalooza 2024, and the purpose of these videos is there's so many people who couldn't make it to Datapalooza, patients who had long COVID, patients who couldn't afford the flights, people who couldn't afford the hotels, scheduling changes, like being a patient is difficult in general. And Academy Health generally, and especially at Datapalooza, we want to continue having a really patient-friendly experience. And so this content is to kind of bring some of the life that you might have missed. That is what makes Datapalooza wonderful. And I did see Sara in the hallway. And of course, I realized, Sara, we've known each other for many years. And we have a shared history, part of which Sara was just going over from the call, part of which we're probably going to talk about again. But I can't remember when I met you. I can't remember. I think we are conference friends, right? So we met at conferences and South by Southwest and Datapalooza. But there's a certain point where I can't remember how I met you, but I definitively remember all of these really precious moments to me where I realized we're kindred spirits and we're trying to get the same kind of things done. And we've been working in the same space. And so, which is the way that it's weird because we really have only been to conferences together, but despite that, I consider you a great friend who has done some amazing work on what seems like kind of a trivial topic. You run contests, but it's not that simple. Please tell me how.
Thank you, Fred, for having me. And yes, I can't remember how we met. We are absolutely conference friends. So Luminary Labs, the company that I founded, is 15 years old this year. And we're a strategy and innovation consultancy, and we do a few things. We help our clients place big bets on the future. We structure partnerships. We develop innovation ecosystems. And what you mentioned is probably what we're best known for, is designing and producing novel funding mechanisms like prizes and accelerators, things that stimulate the market to do something that it would not do on its own by offering typically money, but sometimes data and other resources. We work across 4 focus areas: future of health, scientific discovery, future of education and work, and infrastructure. So health is where I started. It's very near and dear to me, as is Datapalooza. Figures very prominently in our history. Will you indulge me if I go down memory lane?
I mean, please. And I think I've seen you. So we're both South by Southwest people.
Yes.
We've been to that conference a bunch, and we're both Datapalooza people. And I think you were just telling me that South by South was involved too. Tell me more.
Yes. So I started the company in 2009, and I was working with a pharmaceutical company that was looking to identify startups that would have something commercializable in the diabetes space, things that could improve the experience or outcome of people living with diabetes. That was Sanofi. And again, this is 2009. I mean, the iPad wasn't even here, if you think about that. And, we had a few pilots running, and then they said, "This is great, Sara. Can you find us 100 things we can pilot?" And I was like, 100? How am I going to do that? So I went to South by Southwest in 2011. And that was the first year that there was a very big health tech presence. I think there were a few things kind of percolating the years before. But in 2011, not only was it in full force, but that was the Data Liberation year, where Todd Park, you saw Nish Chopra, Amin Bandari is somebody I met at that conference in this very packed room. I have a picture of that room, standing room only, of people very curious about the role open data could have. And I met Amin Bandari, who's now at Vertex, and he was with the government at the time. And he's like, "What are you doing here?" And I explained. He's like, "You should consider a prize, a competition." It's like, oh, that's a really good way to see 100 or more ideas. And so I went back. And by the way, that was also the year that Rock Health and I believe Startup Health launched at South by, and was very privileged to be at those initial meetings. So it was a magical time for the health tech community. Go back, let the pharmaceutical know that we have this great idea. This is how we're going to find 100 ideas. And this is March of 2011. And not only do they say yes, and not only do the lawyers get on board, don't ask me how I did that. Like, I love hugging lawyers, but if you've worked with a pharmaceutical, coming up with an idea in March and then launching it June 9th, 2011 at Datapalooza at NIH. That was the year where we all had to go to NIH, and it's a heavy security. It's just mind-boggling. I really do not understand how we got that through, but we did. And we launched Data Design Diabetes, which called on innovators to come up with these solutions that would improve the experience or outcome of people living with diabetes. And one of the stipulations was you needed to make use of data from healthdata.gov, version, I believe, 1.0. And we designed this in a way that was what we would say luminary. Took a little bit of the lean methodology, a little bit of like accelerator design thinking. At the time, these things really didn't come together. They were disparate activities and kind of made it our own. And it was a wild success. We offered at the time it was $250,000, which, if you recall, in 2011 was a lot of money. And I believe Matt Holt. So hey, Matt, if you're listening, you accused me of prize inflation because at the time I think 5,000, 10,000 was good. I think Walgreens might have had a prize for like 25,000, and here we come in with 250,000. And the argument was like, we have to compete with the angel investors and venture capitalists. And if we really want to stimulate the market, we need to actually put our money where our mouth is. And it was a wonderful prize. And I'll tell you, do you know who the winner was?
No, tell me.
Well, they're two guys, very, very small early stage startup company called Ginger.io. Ginger, which is now part of Headspace. And one of the runner-ups was also a very well-known company that was acquired a few years ago, which was Wellframe. And so what we were able to do is not only stimulate the market to think about a space they were not planning on thinking about, but to get those companies that non-dilutive capital, and even more importantly, access to data and resources and technical know-how that help them build their business in the earliest days. And so we could not have predicted at the time that, I didn't even think we'd run a prize again. It was a project. But it was so successful. We went on to run, I think, 6 more prizes for Sanofi, many other pharmaceuticals. And about a year later at Datapalooza 2012, Greg Downing approached me and said, "Why aren't you doing this for the government?" And I said, "I have no idea what you're talking about, Greg." And he's like, "Well, there's this thing called GSA. You want to get on it. The government is very interested in open innovation and prizes, and companies like yours would be, of interest." And so went through all of those hoops, and fast forward to today, and like we've now designed and produced nearly 40 prizes. And I think some of them are the largest or close to the largest prizes in federal history, which is always really exciting. Every year that
That's incredible.
gets bigger and bigger. So yeah, that it all started Datapalooza for us in that very magical year of 2011.
It's funny. Perhaps I'm realizing why we have just gotten on so well for so many years. So Matt Holt. Well, so first of all, my company, CareSet, started because Ashish Patel and I met at an AT&T hackathon. We met at South by Southwest and kind of just walked in and decided to do an AT&T hackathon together, and we won. We got second place, and it was $1,000. wasn't a big deal, but it showed us that we still had the capacity. We were both cybersecurity guys from way back in the day. It showed us that the team was something maybe we should bring the band back together. And then what we actually do now, which is, we are, I think, the only health data journalism and health data vendor out there. But we got our start doing a Freedom of Information Act request. And at Matthew Holt's Health 2.0 contest, I ran into Todd Park. And Todd Park, I was talking to him about, the day, government's got all this data I didn't even know it's got. And like, what about this? Can't you do this? And all this kind of stuff. And, I thought about even doing a FOIA request. Would that work? And he went back and forth with me, and he said, you should really do that FOIA request. And sure enough, I got what I believe at the time, and possibly could still be, the on a per row count basis, like 80 million rows, the largest FOIA request, certainly out of CMS at the time. And I don't know that it's been beaten since, although now we download those big data sets all the time. But he handed me off to none other than Aman Bandari, who later would help us start things off. And I really want to try to convince Aman, if you're listening, we're going to send you this video. So if you're not listening, we'll make you listen. And I would love to see him at more conferences because I miss him. He's incredible, and he's helped us out at like 10 different stages of the company. But it was all about like the government made this incredibly deep commitment towards open data, something called open innovation more generally, which I think the open data and the contests and the hackathons and is all part of that. And there was a wonderful article that you wrote about this concept of open innovation as a kind of an umbrella term that I believe if we have our act together, we'll get in the show notes. But could you say more about that, please?
Sure. So open innovation is not new. Many people aren't aware that canned food was a product of an open innovation competition Napoleon ran. So pasteurization. There's a longitude prize, or many prizes that go back hundreds of years. So governments have used the concept of a competition and a prize purse to stimulate innovation for quite some time. Henry Chesbrough is the professor who coined the term open innovation, and he has defined it a few times and refined it a little bit more. It's still new for most people. And the way I think about it is like these bidirectional flows of information, which is really something that Chesbrough puts out there, allow for us to think about innovation not in that castle in the sky. Like partnership is prerequisite for innovation now. It's silly. Who goes it alone anymore? In the 20th century, we did everything under lock and key. We had a lot of IP protections, and you did not share anything with anybody. And today, partnership really is what innovation hinges on. You think of like large company, small company, academia and government, or government and company as like public-private partnerships. There are many, many combinations. And if we want to move fast on the problems that matter, we have to come together. I mean, we saw this during COVID. We see this through many of the problems we work on. And so one of the things that we did in 2018 is we just got curious. We'd been running prizes for a while. It was a practice for us, but it wasn't the majority of what we did. It was something we did, and we were curious why is it that some people say challenge and some people say prize and some people say prize competition? Why do some people get confused between grants and prizes? So we just scanned it and surveyed over 100 people. We interviewed a large number of people across the public, private, nonprofit sectors, and we got some answers. Language matters. It reminds me a lot of the early digital days when like nobody really knew what a website was. It would be like somebody's nephew was like in the corner of the office being like, hey, I have this idea. We're going to use the internet. And so that's what it felt like in 2018. And so we just repeated that survey in 2023, 5 years later. What has changed? And a few themes came out. A partnership really was the leading concept. Some people still reject the idea of open innovation, the term, I should say, not the idea, but the term. They really think of it more as like, how are we partnering in the future? It's almost like open innovation is table stakes. So whether it's a prize or whether it's a hackathon or whether it's an accelerator, or maybe it's just our door is open, come talk to us, or we're going to present some data, make the data available. All of these things are open innovation. It's a very, very large umbrella. You could even consider consortia a type of open innovation. And that's what the people told us. So, I think that concept of partnership being prerequisite is really core to how we go forward in the future. Private sector, public sector, or nonprofit.
Well, no, and the language is important. I went to cybersecurity, and then I came to health IT in an open source context. And of course, open source is a classic way to do open innovation. And some of the people who are the luminaries of the open source movement, Richard Stallman, who is, let me just admit, a problematic character who's difficult to work with and not a very nice human being most of the time, but has some really deep insights. What he likes to point out is that the term intellectual property is a brand, right? There is no such thing as intellectual property. What you're saying is that trademarks and copyrights and data and patents should be thought of the same way the property is. Well, if I'm sitting in a chair, sorry, you can't sit in the chair. And if I have an apartment, right, and it's a one-bedroom apartment with one bed in it, I'm the only person who can sleep comfortably in that one-bedroom bed with them. And property is fundamentally limited, right? And so when you bring that idea to something where the thing that is blocking is that there is a lack of collaboration, there is a lack of transparency, there's a lack of standards, there's a lack of, there's a cabals happening where people are making business partnerships in a way that takes advantage of other people. It's fairly obvious that the idea of treating ideas as scarce things
Mm,
can be a really deep problem, a fundamental problem. And I think what I like about open source and open data and some of these contexts is that it forces you to reevaluate those assumptions in a really kind of profound way. And of course, I think this is just going to have to be an aside since I don't want to ambush you with AI topics. But right now, the open source community is struggling to define what is an open source large language model. Obviously, everyone agrees that if you are not sharing the weights, it's not open source. But then the other question is, do you also have to share all of the materials that it was trained on so that you can see the relationship between the weights and the model and everything else? And so, in general, that's a perfect example of kind of our society wrestling with what it means to have a model of collaboration and transparency that is not a hoarding model.
mm,
I think not a hoarding model is probably almost, because you're right. When people say open innovation, I don't think they're talking about it with the formalism that you do. Or when I say open source, I mean something real specific,
yeah,
open source definition.
yeah.
And so I think we kind of trick ourselves that everybody's talking about it. But in a sense, as long as we communicate the not hoarding part,
Mhm.
where it's like we're going to share, we're going to collaborate, we're going to work together, maybe we will each make less money, but maybe our impact in the world will be multiplied and be exponential. Tell me more, just react to that idea about
Yeah,
like
it's
how,
such a great question. It's reminding me of the purpose of tiers of access. Like, there's nothing wrong with tiers of access as long as you're clear about why some data should be shared and some should not. And some of the very early prizes using patient data, we did not run this, but we ran a later prize with somebody who said that they spent more money trying to anonymize the data than they did on the prize. It was
wow,
such a headache
wow.
because you want to protect people. And so this is where I think things like synthetic data are interesting. And I'm sort of getting off of AI a little bit, like more broadly. But for the VA, we designed and produced Mission Daybreak. It was a $20 million prize to prevent veteran suicides. And what I loved about this prize, like a lot of, some people are like, that's way too much money. Why are you spending money on a prize? I'm thinking, do you know how much money is invested in behavioral health right now? Do you know how much of that is going to suicide prevention? Almost zero. Like, I love anything behavioral health. Like, we all like have this, we live in this like mental health crisis. We could all benefit from these solutions. And yet we are not investing money seriously in suicide prevention. And veterans are at risk far more than the general public of suicide.
When we do, I think it's even more important to say, when we do make investments in suicide prevention, it is not in innovation in that space.
Yes, correct.
It is,
Correct.
hey, what's tried and true, what's safe
Yes.
to do, not
Yeah.
questions like, and I really love this about that particular contest, which I did my best to promote at the time. I
Thank you. Thank you.
but
It was
it was
interesting. Sorry, go ahead.
how can you get these kind of exponential
Yeah.
impacts?
Yeah, and it was interesting how people, they loved it. "Oh, I don't like that prize," or "That's too much money," or "Why are you casting such a wide net?" Well, for the reason you just said, which is like we have to do something differently. We need to collaborate. And one of the prizes, so in addition to money, and it was, obviously a lot of money. So we had a virtual accelerator for 30 teams. Another 10 teams got money as an honor, like, congratulations, you have a really good solution. Keep running. Um, but we could only take 30 into this accelerator. We provided synthetic data to these teams. And so VA has this great synthetic data capability. The teams that were most ready to make use of it were off to the races. Those that were newer, there was an educational module like, this is what synthetic data is. This is how you can use it. This is, obviously when you're working in suicide prevention with the veteran population, you want to be mindful and respectful of privacy. And so I thought that was a really creative approach to open innovation. In the following year, we provided technical assistance to the top teams. And now in the third year, we're helping them integrate. And so, a lot of people think of prizes as you get some money for an idea. That's absolutely not what we do. Most of the prizes Luminary Labs runs have a long trajectory. So whether the prize is a year and there's follow-on support to integrate, or whether it is a 5-year prize, such as, or a 4-year prize, the BARDA vaccine patch prize, that's called Patch Forward. It's a $50 million prize. We believe it's the largest prize, cash. The idea here is to incentivize vaccine makers and patch makers to create an RNA vaccine in a patch form factor. And the reason you want to do that is it's shelf stable. So vaccines require cold chain storage, which is what many people don't have access to vaccines around the world. I mean, you heard about that during the pandemic. We'd ship these vaccines and, they would spoil because they could not be refrigerated. So you think about whether it's sending vaccines around the globe or producing them locally around the globe where they have a longer shelf life, if it's for the national stockpile, whatever it might be, like we believe it is possible. And so that is a longer range, multi-year prize to get through phase 1 clinical trials.
Well,
And so it's a
and
power of partnership.
when you're talking about software, you can make a $50,000 prize that is competitive with an angel investment seed rounds,
Yeah.
and you can get a software company off the ground. But if you're talking about something that's going to have to go through approvals,
Yeah.
well, now that prize sounds a lot smaller, right?
Yeah. Yeah. So that's, we have a couple of those. So the Limex Diagnostics Prize is now in its phase 3. And it is moving towards FDA approval now. And so that started as a public-private partnership. And the private partner, now that we're closer to commercialization, is now sponsoring the prize. And Quest and LabCorp, they're participating as technical sponsors, which is really amazing. And that's a $10 million plus prize. The CDC Lead Detect Prize, which has a demo day coming up, I think next week, depending on when you publish this.
We'll try to get it out so that
Yeah,
that.
we need to,
Try to do
we need better ways of detecting lead in blood for children. It is astounding. We know how to solve this problem, but we need to be able to see who actually has elevated blood levels. And there aren't that many tests out there, and they could be faster, better, smaller, less expensive. And so, in that case, that's a $1 million prize right now, but there's a lot of interest in the broader community. So, when you talk about, like, there's nothing wrong with a $5,000 prize or $50,000 prize. The prize person needs to be commensurate with what you're doing. The minute you get to the FDA approval process, that's where we start to see, 7 and 10 and 50 million. And even that is just defraying your costs. Like, there's no way, a company is able to bring the product to fruition, but it stimulates them to maybe give it a go.
Well, no, and
Yeah.
so when we started again, I'm realizing there's just so many parallels between what's happened at your company and mine. We crowdfunded our first data set. So we said, well, we're going to sell access to this. If you want to chip in, you can get access to this data set that we've obtained in the FOIA request. And we're going to get a bunch of more data. And then since then, I think we've released, I think we are, and of course I like to calculate it on a per row basis, right? Because the data sets that I like to go after have a lot of rows, and the data sets that normally come out of CMS don't. And so on a per row basis, I release more data now as a data journalist than CMS does that are CMS data sets, right? And they had this wonderful program that we have data access under now that was part of Niall Brennan's work, and another person who was, part of this kind of this open data revolution. But that crowdfund, when we first started, that was 6 months, but it was 6 months for us to figure out how to have a business, and 6 months to figure out, what are we going to do? Like, how do we commercialize this? What are our options? What's our business plan? Who should be our partners? So, but if we were a device company, or we were a lab test company, or we were, making a new delivery system with a patch or something like this, well, a year, 6 months of playtime, it does cost millions of dollars just to get that thinking time.
Yeah. Yeah.
So I would say they're, your prizes are too big, your prizes are too small. It all depends on how you look at it. But trying to figure out, and I think this is the common thread here, is trying to figure out what entrepreneurialism and business and big pharmaceutical companies and big hospital chains and American Medical Association, figure out what they're going to get us. And it's not nothing. Those organizations do good things. But then if you start looking at what is not going to get done under those paradigms and what is still absolutely vital, rare diseases, immunological mystery diseases. So I continue to work with Dr. Honey, who does a lot of the Lyme disease innovation from within the government. And the parallels between long COVID and Lyme disease, which
Yes.
is to say they are both immunologically mysterious, is my not a doctor summary of what is obviously a much more clinically subtle situation. They're pretty substantial. Like it puts you in a
Absolutely.
weird place when the
Yeah.
immune system starts to go sideways. The symptoms are not, are not boxable in the same way they are for other conditions. And so it's amazing how much of the infrastructure that was built up to handle the mysteries of Lyme disease are now going to be
Yes.
helpful for long COVID.
I just came from a conference this morning on that topic.
Really?
The private sector partner for the Limex Diagnostics Prize, which Dr. Honey was stewarding. So the Stephen Alexander Cohen Foundation is the partner on that prize. And today they held their Edge of Medicine conference, where a number of people were speaking on the similarities between long COVID and long Lyme, as well as many other disease states, conditions that are post-infection, what they would call post-infection diseases. And we're just starting to understand this now. It's almost like in retrospect, you say, like, isn't it silly that we thought you could have a disease and you'd be fine afterwards and there wouldn't be some type of imprint or change in the body? Of course there is. Of course there is.
Well, and then, but going back to what does our system do really well with? I mean, we have dramatically improved. If you have a heart attack,
Mm-hmm.
and God forbid I had a heart attack after this podcast was over, but as long as I get,
No, don't say that.
no, I mean, I'm my years in health IT and healthcare. If you've worked in a hospital, you end up having some morbid conversational tendencies, which I apologize to you, therefore, and I also apologize to the audience. I'm sorry, it's just how it works. Let's say
It's
I
just
have that.
red.
I know. Let's say I have that heart attack. As long as I can dial 911, so much is going to go right. Very nearly as much as could go right, based on the distance that people are, who could help, how fast they get here, how fast I would get help. We have really revolutionized those things, but that is all the emergent care model that we do
Mm,
really well with in the United States, where someone has an acute problem and we spend a lot of money immediately responding in the appropriate ways. And then when you have something that is not emergent, that is after the emergent, or that keeps lingering on, and you fall in between the gaps of where the healthcare system is, it is much more difficult for our system to address those things. So,
yeah, let alone preventative.
no, I mean, well, I mean, of
That's
course,
a whole other podcast.
yes, that's right. But I do think that's another good example of things that are more about the innovation. So, tell me more about what comes next. I think it's
Yeah.
funny because Dr. Honey is, relatively speaking, she's actually been around for a couple of years, but she's a good example of someone who's really making waves in the space of open
Mhm,
innovation, open data now. She's been working with Datapalooza and at Datapalooza. Todd
mhm.
Park and Mon Mondari, I want to bring them back. They kind of moved on to do other things. I wish we could bring
Yeah,
them kind of classics. Who are going to be the players? What are they going to be the approaches that really matter in the future? What do you think should come next?
yeah. Yeah, so I think, let's start with Datapalooza. So this year I was on the advisory committee and I thought it was really refreshing to bring in new voices and people who've been around the block and people who are new and say what needs to be different. And so there are times where we need to establish new mindsets. So I thought that that was like a very good, example of role modeling of like we have to think different. What excites me about going forward and thinking about, Luminary Labs' own anniversary. And by the way, Fred, I did pull up the first email I sent you in 2013. It says, "Hi, Fred. I believe we met at a recent conference. Was it South by Southwest? Question mark. And then I had an ask for you." So over the past, decade plus, I think about the work that we've done as a company and that the broader open innovation community has done. And at Luminary Labs, we've now worked with three different administrations, which is like makes me feel not young. to say
Well, no,
that.
I was just thinking, I was looking at some of the doing the same investigation, and I saw these pictures of you where you had just perfect brown hair. And I've gone farther than you. Have this really lovely silvering, kind of decorating your hair. It's gorgeous, absolutely gorgeous. But it was a little bit different. And then I realized how my hair is different. I don't have a brown
Curls.
hair on my head anymore, right?
You had the curls. I'll represent the curly
I
people.
can get the curls back, but I can't
Okay,
get
get the curly back.
can't
Okay,
get
we'll talk about gray blending later. But in the interim, thinking about having supported three administrations and a fourth that will be coming, we've been thinking a lot about our advice for this next administration. And innovation is not a partisan activity. So that's wonderful. Like it really, like this is an opportunity to collaborate to solve the world's most thorny problems. And knowing that partnership is prerequisite, that means, yes, government and private sector and academia, et cetera, startups, but it also means reaching across the aisle. And so when I think about what we need to do, we need to reduce friction for all things open. And every administration has its own priorities in different contexts. And there are a few things that happened many years ago that I'd like to see return. We were talking a little bit earlier about the role of the chief technology officer, which is a really recent, last 10, 15 years ago, we had our first CTO. We also had a prize lead in the White House, a person whose role was to encourage federal agencies to use prizes, which prizes have become increasingly adopted across federal agencies. It is not practiced uniformly. There are different interpretations of the Competes Act. There are three memos from, I believe, 2010 that I still forward to new clients when they say, is this going to trigger FACA? And we're like, no, it will not. And here's the memo that clarifies that it does not, or the Paperwork Reduction Act, or, is it possible to have a judge who is not a federal employee? Like all of these things are possible, and every federal agency might have its own rules.
the
Uh,
answer is yes.
you say-
I want to be a judge for you someday. I'm
You
just
can,
telling you
yeah,
right now.
absolutely. Different. And some agencies say no. They say you have to be a special government employee, but like for the most part, you are. If they decided to, they can. There is,
There you go.
so.
I
Um,
have hope. My hat is firmly in the ring now. I'm just
yes, and in the absence of an individual whose job is to steward and shepherd the concept of open innovation, knowing that it is still relatively new for most people and organizations, it can be scary. When there's no playbook, it's, how do you do something that doesn't look like what you did in the past? Like most people, even when tasked with doing something highly innovative, will always go back to standard operating procedures. You don't get fired for doing what you've done before. You also don't necessarily get highly innovative results. And so, it takes somebody who has the political, social, and financial will to make those investments. So I would love to see a return of those roles in the White House. There have been some amazing people who've carried the torch. Jeremy adore her at GSA, who's been really championing prizes and challenge.gov. I would like to see her have, again, a counterpart in the White House that is really carrying that torch broadly for the administration. The memos I mentioned, there are three of them. If anyone's curious, I'll
can you
forward
give
them
them
to
to
you.
me?
They're really,
Just please send them over. I want to link to them.
yeah,
I need to know them. I need to be able to share them.
they're part of history. One is just like an FAQ, and we always forward these same documents over. They need to be updated. The Competes Act has been updated, so we need updated memos to clarify what is possible. Most federal agencies are like, well, we can't partner with the private sector. You absolutely can. That is the purpose, the entire purpose of, um, you know, when you look at the Competes Act and the prices, it's like we're supposed to come
Memos.
together to innovate. I do think that there's a lovely community of practice. There's a listserv for people in government working on open innovation. I'd like to see that taken a step further. Like, for example, every general counsel, like office of general counsel, like there should be dedicated courses, credentials that incoming lawyers can take. I'd love to see a library of case studies and precedent. Like oftentimes, like almost every prize we run, they're like, well, do you have examples of where somebody else did that? And we're like, absolutely. Here's what NIH did. Here's what the National Geospatial Intelligence Agency did. We should just curate all of these examples run these niche issues to show this is what is possible.
I,
Another thing, oh,
before you
sorry.
go on,
Yeah.
but yes, and what you're saying now. I think one of the most successful things that USDS did was to have a playbook of how they did
Yes.
technological innovations. And that playbook, and I have been working and trying to get a second playbook into their repertoire for all the same reasons, but it it these kind of short playbooks that are kept updated, that change over time, that show you how to bridge between what government has been and parts of the government. I mean, the rules the government people have to jump through. They are to protect the American people from, I think, fraud, people trying to steal from the government. I think they're generally good, but I think it also creates a wider and wider delta between the pace of innovation
Yes.
and change on the outside and the pace on the inside. And if you are a government employee, I want to look right into the camera, and you're thinking about running a contest, and you're considering whether to hire Sarah or someone else who's Sarah's competitors. Please consider carefully as you think about,
Yes.
like, this feels risky. Well, sure, but think of the last 5 projects you were involved with a federal contractor. That, you know, how well did that go? And then ask a bunch of other people,
Yes.
how well did the last 5
Yes.
federal contracts to get something done
Yes.
go? In general, the federal contracting business model produces very good results in 10% of the cases. But in
Mhm.
those cases where innovation is required, where getting best practices out the door is required, getting something that's never been done before,
Yeah.
they don't have a great history.
Yeah, it's, I mean, it's really incredible. I couldn't agree with you more. And, I will also put that out there. If you're a federal employee and you're not sure where to start, I give free advice all the time. I'm glad to just, even if you're going to run it on your own, or think about an accelerator or a different model, like, I'm always willing to share best practices and case studies. Um, I have one more wish, and this is
Shoot.
my stretch goal.
All right, stretch goal.
Are you
Shoot.
familiar with advanced market commitments? Is where
Of
the
course not. As per always, I need to be educated on how things work.
I don't know. Not everybody throws out AMCs every day. So this is the idea where the government will agree to buy something in advance of it being developed or innovated. And you could think of like COVID vaccines as an example. Um, they are very similar to prizes. They could be run as a prize. And I would love to see
I
a
see.
prize that culminates in advanced market commitment. Now, we do have clients who have said that they will make use of the end product. It is sort of understood that there could be a contract, but is not formally part of the prize. There's really no reason it can't be. Um, maybe maybe we can use all that we've learned over the past like decade plus in prizes to build up an understanding of like what would it take to create an advanced market commitment initiative. I think it borrows the best of prizes and accelerators and technical assistance. Um, I think it should be um, something that is well thought through. The design, you can never invest enough in design for a prize. The biggest mistake I see is like, we got a lot of money, we're going to launch this thing. Can you do it in 3 weeks? I'm like, absolutely not. Like, you get kind of what you pay for. You kind of also get what you design for. And so I would love to see a few agencies in the next administration, or maybe one. Maybe I'm thinking a little bit more too aggressively. I'd like to see one agency come up with an advanced market commitment for a moonshot, something that is critical to humanity, where the government should be the buyer and the world needs this innovation. And it would not happen if not for that advanced market
Oh, I
commitment.
mean, Sarah, so let me agree with you 100%. That's exactly what should happen. And what I see you talking about is, and it's really interesting because we started off the call talking about how the prizes were kind of seed money and they were part of the.
Hmm.
Now you're actually talking about, well, how do you get to that second
Yes.
round of investment, the first customer, these kinds of things? Sounds exactly right. But I also think that you could do a lot with soft innovations. Why can't we have a COVID test that automatically reports its results? Like, that's not hard. We're real close to that. All we need is some coordination and some other stuff. That's exactly the kind of stuff where the multiple agencies who continue to buy COVID tests could say, you know what, if the industry started going in that direction where you could have something that you could automatically report into Apple Health through your iPhone, and then Apple Health could report it on to the CDC or whatever.
Yeah.
Those kinds of innovations, which we are so close to those things, would also be a great thing to say. Not only will the government commit to giving you a prize for developing it, but we will be your first customer.
Exactly. That's
Formal.
the idea. That's the idea. I would love to work on advanced market commitment, either tied to a prize, or maybe as a standalone. And I have a lot of ideas on how that could happen in places where it could happen. So again, I'm willing to give some free advice, or
Anyone who will listen. That's right.
anybody will listen to me. And I'm not the only one. I think there are a number of people. If you know take a quick scan, a lot has been written about AMCs over the past year. And so there's a really cool market shaping accelerator out of the University of Chicago that has been. They basically ran a prize for AMC, so they gave away money to people who had ideas for advanced market commitments. Pretty cool, very meta. So yeah, that's my advice for the next administration.
Well, I very seriously doubt the next administration, who it is, the next president of the United States, is going to be the one watching this. But
You never know, Fred.
I endorse those ideas, and let's hope that our videos get watched by the next president. Low chance, but let's hope.
Somebody who works for the next president. Let's remind ourselves of Aman Bhandari. He was the guy who, back in the day,
the next Aman Bhandari.
And the next Aman Bhandari.
But I think the key thing that I really love to hear, and it's so interesting, because what I realize every time I talk to you is that you're thinking about it from the contest lens. I think about things from the data lens. But when you're thinking about data, the FOIA has already been reformed multiple times, so that if you do FOIAs for data, they will automatically become FOIA data sets if they've been FOIA'd enough. Mm-hmm. The Evidence Act already exists, which gives you a broad mandate to provide educational resources around data to federal employees. There's all of this work that's already been done on policy, around policy, to do openness and transparency. And I think about the data stuff all the time. And it's funny because people will come to me and say, "Oh, Fred, you're an open data guy. Well, what laws do we need?" I was like, "We have the laws. We just need to do what the law. We need to exercise the power that the current laws give us." And if we did that, I don't know why my camera's zooming in and out.
I don't know.
All right. Oh, I turned on AI tracking. I'm so sorry. Well, look at this. Isn't it great? This just goes around. Okay. So
I think this is our signal to wrap up, Fred.
Yes. You know what? I think it might be the end of this podcast here. Sarah, do you have anything else you want to talk about? Let me just give you the blank end question.
I just want to end on thank you for inviting me and inviting the audience to consider the psychology of abundance that comes with open innovation. It is a far better way
of abundance, turning the whole thing I was saying about not hoarding into a positive. I think that's
psychology of abundance
of the differences between us. I call out the negative, you accent the positive.
We all have our role. Fred.
I was going to say, is a perfect, so I'm the one who morbidly discusses all the problem. And what if I had a heart attack after the call? And you're the one who ends things on abundance. Sarah, thank you so much. There will be an incredible amount of show notes. I think we're going to have some help collaborating all the things that Sarah talked about into a series of links. So if you want to, scroll down a little bit, you could probably find almost everything that we've talked about, which is a lot. We covered a lot of ground on this call. Thank you for the time. I really appreciate it.
Thank you, Fred.